Good afternoon, folks. This afternoon's topic we are discussing healthcare cost sharing programs. Okay, so those are the kind of programs that people typically join to offset costs of healthcare. So here we go with today's discussion. The headline describes a surge in healthcare cost sharing programs that appear to offer cheaper alternatives to insurance, but actually leave many people financially unprotected because these programs operate outside the rules that govern real health insurance. What the headline is saying, the surrounding reporting shows that the boom in health cost sharing programs is driven by people fleeing unaffordable insurance premiums and denials. But these programs exploit gaps in the regulatory system and shift financial risk back onto members. They market themselves like insurance, but legally they are not insurance, which means they don't have to pay claims, follow customer protection laws, or maintain reserves to cover medical bills. Why people are joining these programs? Sources show several forces pushing Americans toward cost sharing groups. High insurance cost and denials are driving people to seek cheaper, simpler alternatives. Many programs have aggressive marketing and present themselves as community driven, affordable, and values based. Some groups have uh, scrutinized and broadened their appeal beyond religious communities, expanding rapidly. This creates the appearance of a solution, but it's fragile. It's a fragile one. How the system is broken and exploited. The articles highlight several systematic failures. Cost sharing ministries are exempt from state insurance laws in over 30 states, meaning regulators cannot require them to pay claims or maintain sovereignty because they are largely unregulated. These or there is limited data, no guaranteed coverage, and no legal recourse when bills go unpaid. Some organizations have histories of mismanagement, fraud, or self self dealing established by the regulatory vacuum. This lack of oversight is the broken system the headline refers to, a system where entries, entities can function like insurance without the obligations of insurance. How members end up financially exposed. The reporting gives multiple examples of people left with thousands in unpaid medical bills. A family was denied coverage for a C section because of a fine print exclusion, leaving them with 7,000 in bills. A pastor was left with 38,000 in debt after his heart procedure was labeled pre-existing condition. A woman with cancer saw her bills suddenly stop being paid, leaving her with 10,000 in debt while she was undergoing treatment. These stories illustrate the core problem. Payments are voluntary, not guaranteed. Members can follow all the rules and still be denied. The deeper meaning of the headline. The headline captures a structural truth. Cost sharing programs are booming not because they are strong alternatives, but because the formal insurance system has become so unaffordable and adversarial that people are willing to take enormous risks. But the boom is built on loopholes, lack of oversight and marketing, not on reliable protection, leaving many families exposed at the worst possible moments. Faith based health cost sharing ministries often look like insurance, but they are legally and operationally different. Many have maternity waiting periods, exclusions, and limited consumer protections, which is why childbirth bills can be denied or left unpaid. What happened and why? Healthcare sharing ministries pool members' monthly contributions to reimburse medical costs, and many market themselves as faith based alternatives to insurance. They are not insurance, and they are largely unregulated. So their rules, waiting periods, exclusions for certain pregnancies or fertility treatments, lifestyle lifestyle causes determine whether a claim is shareable. This has left some families with large unpaid childbirth bills. When ministries apply maternity restrictions or first year exclusions, important legal limit federal protection like the No Surprise Act protect people with group or individual health insurance from certain surprise out of network bills. But those protections generally do not convert a cost sharing ministry's denial into an insurance obligation. If you were uninsured or in or un or enrolled in a ministry not an insurance plan, the No Surprise Act won't automatically force payment. Some ministries and some faith-based programs do offer maternity sharing, but with long membership waiting lists or wait times. Waiting periods or caps. Others explicitly exclude pregnancies uh, conceived before enrollment or those involving assisted reproduction. Read the fine print. Examples and reporting show those rules are common. What you can do next. Practical steps. Gather your paperwork, membership agreement, all communications, itemized hospital bills, EOBs, if any, and the ministry's member guidelines. File an internal appeal with the ministry using their formal process and cite the exact policy language you believe was applied incorrectly. Keep copies of everything. Ask the hospital for an itemized bill and financial assistance. Many hospitals have charity care or sliding scale programs and will negotiate or reduce balances for uninsured patients. This is standard hospital practice. Start with the hospital billing office. Okay, guys, give me 1 second here. Contact your state insurance or consumer protection office to report misleading marketing or unfair practices by a ministry, regulators, and consumer advocates have been scrutinizing these groups. Use the No Surprise Help Desk and state caps for guidance if you received a surprise bill and you had any form of insurance. The CMS guidance explains when protections apply and when and to where to get help. Centers for Medicare and Medicaid Services. Risks and trade-offs to keep in mind. Switching mid pregnancy may not cure coverage gaps because many ministries and insurers impose waiting periods or pre-existing rules. Appeals can take time, and many not succeed, while hospitals may pursue collections. Okay, guys, that's your A for today. I will be back on with B and C in a bit. For now, Gator Wellness. Take care, guys. Be back on shortly with the rest of today's show.